Hey guys, Bob Otto here again, physical therapist for Reach Climbing and Fitness. Today's anatomy lesson we're going to be talking about the knee. When you look at the knee, it should be, a nice simple hinge joint, right, between the femur of the upper thigh and the tibia, which is the primary bone of that lower leg. Diving deeper into that, you have the patellofemoral joint between the patella, that kneecap, and the femur. The patella glides nice and smooth up and down in a groove in that femur. Gives it biomechanical advantage and strength with contraction of those quadriceps and those big muscles in the lower leg, and also helps with some friction reduction with that kind of motion. As far as stability in that knee, we have several ligaments. Looking on that outside, you have the lateral collateral ligament, and on the inside is the medial collateral ligament. Diving deeper into that joint, you have the ACL and PCL. With the medial and collateral ligament, they provide stability with medial and lateral, just as it sounds, stress on that knee. And then the ACL and PCL help prevent any kind of anterior or posterior, forward or backward translation of that femur on the tibia. Muscular, we always think simple, right? You have the quadriceps in the front, the hamstrings in the back, but what also give some good stability to that knee joint is the muscles in the glutes and the hips, right? You have muscles on the inside of that thigh called the adductors, and muscles on the outside for a common term called the abductors. And any of that stability of that knee comes from the hips and glutes. So when we're rehabbing that knee, we dive into the hip for some upstream kind of contribution to that knee injury as well. Common injuries we see in the clinic with climbers, simple as patellofemoral pain syndrome. And again, that's when something goes a little wonky with that joint, where that patella is not gliding nice and smooth in that joint. You see that a lot with your boulders that drop repetitively from the wall, landing just over and over again, dropping from the top of the wall. And with that, you often don't have good glute strength. Another thing we see in the clinic is the ACL tears. You've seen that last year with Alex Puccio, and God, even a year or two prior to that, she tore that same ACL. And with that, the nature of the injury was just an awkward landing. Again, dropping from the bouldering wall. You can get that from sport climbing too, where you just come awkwardly into the wall, and it's a little bit of rotation of that lower leg and often hyperextension of that knee. Of course, you can strain the MCL with any kind of awkward drop knee on the wall, so you want to be mindful of that. Just going to your body's limits. And then the other injury we see are the meniscal injuries that sometimes coincide with some hamstring issues, and injury, sprain, strain. Meniscus and the hamstring can come from like an awkward or powerful heel hook. So again, be mindful that you are building some good strength in addition to our climbing strength. All right. Again, that's a brief synopsis of that joint. Next video is going to be on that injury prevention and how to strengthen the glutes and that lower leg. Any kind of questions, don't hesitate to reach out to me. and can always comment on the videos, and I'll be looking out for those. All right, thanks again.